Hi, my name is Shaylee. I'll be your student nurse practitioner today. I'll be doing a head-to-toe assessment on you. It should take about 40 minutes. Is that okay? Okay, so looking at my patient, she is sitting upright, smiling. She's making eye contact with me. She's like oriented. She has strong mobility as she was able to ambulate independently when walking into the room. I see no signs of facial droop. Looking at her skin, it is pink, appropriate color for ethnicity. I see no lesions, rashes, tattoos. I'm gonna go ahead and look at your fingers. Looking at fingers, I see no signs of clubbing. I see no cyanosis. Cap refill is less than 3 seconds. Her skin turgor is less than 3 seconds, which is an appropriate finding. Looking at her hair, it is evenly distributed in her scalp. Texture is smooth. Looking at her facial features, they are, her eyelids are symmetrical. Her eyelids open and close freely. No discharge. The eyebrows are symmetrical and expand beyond the outer canthus. Nose is symmetrical. I'm going to go ahead and palpate the inner corner of your eye. Any tenderness? And then what about your eyelids? Any tenderness? No. Okay. And then again, in practice, I would do the other side too. And in practice, if I only do one side, I would do the opposite, of course, in practice. I'm going to assess your TMJ. Open and close your mouth. Any pain? Okay, so no pain or signs of clicking noted. I'm going to assess your masseter. So just masseter muscle. So go ahead and clench down. Any pain? Okay, good. So no pain noted there. And then I'm going to go ahead and start with the eyes. So looking at the eyes, they're symmetrical. Again, they open and close. Eyelashes curl up and away. I'm going to look at the conjunctiva. It is pink, moist, free of any lesions. I'm going to go ahead and look at the pupils. So looking at the pupils, they are equal, round, symmetrical, and constrict to light, and consensual light response occurs in the pupil bilaterally when I shine the pen light on the right side. And then corneal light reflex is also noted as the light coming in from the window is equal bilaterally, symmetrically in the eyes. And then I'm going to go ahead and we can test your visual acuity. So we'll hold it about, here, I'll hold it actually for you. And then I just want you to go ahead and read the lowest line that you can read. Just try to stay straight. Yeah, don't try to lean in.
9378266X0041.
Okay, so patient's visual acuity is 20 out of 25 bilaterally, and you're wearing contacts? Bilaterally, okay, with contacts. And then we'll cover the left eye. And again, same thing.
Same, I think.
Go ahead and repeat it.
Sorry, my eyes are blurry now.
Lowest line, it could be.
9378266X0041.
Okay, so patient's visual acuity is 20 out of 25 in the right eye. Of course, I would do the other eye in practice. And then we're going to test your visual fields. Okay, we'll go ahead and still cover the left eye. Okay, so just tell me when you can see my finger, okay?
No. No. No.
Okay, good. So that's intact. And then we're going to go ahead and test the extraocular movement. So follow my finger. Okay. Just with your eyes, okay? And then convergence is noted. And then we'll test for accommodation. So go ahead and just look at my finger, look at the wall behind me, look back at my finger. So the pupils constrict when looking at my finger and dilate when looking behind me. So accommodation is noted. And then we're gonna go ahead and look inside of your eye. I'm just gonna switch this out for my ophthalmoscope. Okay. I'm gonna get pretty close to your eye. I'm just gonna go ahead and look inside your eye, okay? So the red light reflex is noted. The macula and fundus are present. No opacities. No nicking present, no retinal detachment or hemorrhages, and of course I would repeat that on the other eye. It's an appropriate finding. And then I'm gonna go ahead and move down to the ears. So looking at the ears, the patient's ears are bilateral, symmetric bilaterally. I see no rashes, lesions, color is appropriate for ethnicity, no skin breakdown behind the ear. Gonna go ahead and palpate the auricle. Any pain? What about behind the mastoid? Any pain? No. Okay, so no tenderness noted. I would do that in the opposite ear as well. Gonna go ahead and look at the inside of your ear. Okay, so just gather my otoscope here. Okay, so we're gonna look at the inside, okay? So looking at the inside, the eardrum is a pearly gray. See no signs of inflammation, no drainage. Cone of light is 5 o'clock in the right ear, and I would do that, of course, in the opposite ear as well. And then we're gonna do a couple hearing tests. So first we'll start off with the we'll start off with the whisper test. So just occlude your left ear, okay? Yeah, cover it, and then I'm just gonna whisper some words, and I want you to repeat them back to me.
Banana bread.
Okay, correct. And then we're gonna do the Rinny test. So I'm gonna go ahead and activate this. I'll put it behind your mastoid and then in front of your ear. Just tell me when it stops ringing. I'm sorry. And then I have a clock on the wall that I'm just looking at to count. Okay, so air conduction is greater than bone conduction, which is an appropriate finding. And then we're gonna go ahead and do the Weber test. So with that, I'm gonna place it in the middle of your head. Tell me, can you hear it equally in both ears? Okay, so sound is heard equally bilaterally in both ears. So that's an appropriate finding. And then I'm gonna go ahead and look at the nose. So looking at the patient's nose, it is midline to the face, it is symmetric, see no lesions, no rashes, no discharge. I'm gonna go ahead and look at the inside of the nose now. So just go ahead and look up. Okay, so looking inside the nasal mucosa, it is a healthy coral pink. I'm sorry, can you come down a little bit? Okay. It's a healthy coral pink. I see no drainage, turbinates are not at swollen or inflamed. Septum is midline. Okay. Sorry. Then septum is midline. I'm gonna test for nasal patency. Okay, so nares are patent bilaterally. Then I'm gonna go ahead and look at your lips. So looking at the patient's lips, they are symmetric, midline, soft, smooth, free of any lesions. Gonna go ahead and look at the inside of your mouth. So just go ahead and say ah. Okay, so looking inside, it is a healthy pink coral color. Is free of lesions. Go ahead and say ah. Uvula is midline. The tonsils blend in with the oropharynx. The gums, I'm just gonna lift like a little. No, I'm sorry. I'm gonna try to see your gums. Okay, gums have clearly defined margins for each tooth, and then stick your tongue out to move it side to side, up, down. Okay, so tongue is soft. Veins are present on the lower aspect, free of any lesions. And then we're gonna go ahead and look at the neck now. So looking at the neck, it is appropriate color for ethnicity, free of any lesions. I'm gonna go ahead and palpate the trachea. Any pain? Okay, so trachea is midline. Then we're gonna test range of motion. So I want you to take your chin to your chest, chin to the back, or I'm sorry, just your head back, chin to the left side, to the right side. And again, we'll do it with resistance. Okay, so come down. I'm gonna try to push. Okay, don't let me push. Okay, and let's do the right side. No, like just turn. Don't let me push though. Okay. Okay, against resistance on this side too. Okay, good. And then to the back. Okay, good. So good range of motion on the neck, 5 out of 5, and good sternocleidoid mastoid strength. And then we're gonna assess the lymph nodes. I'll just say them and tell me if you have any pain. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical. And I'm gonna go ahead and go like this for your supraclavicular, and then infraclavicular. Any tenderness? No tenderness noted. Then I'm gonna assess your thyroid here. I just want you to look. So you don't look, just look straight for now. Okay, now look right. Go ahead and swallow. Okay, good. So thyroid is free, mobile, free of any nodules. It's rubbery, which is an appropriate finding. And then we're gonna assess your cranial nerves. So I want you to go ahead and raise your eyebrows up, down, close your eyes tight, and then open them up wide, really. Open them up wide, puff out your cheeks, and then smile, frown, and then stick your tongue out from side to side. Say ah. Okay, and then shrug your shoulders, and then don't let me push down when you shrug your shoulders. Okay, good. So cranial nerves are all intact. And then I'm gonna go ahead and we're gonna I'm just gonna take a couple deep breaths. Okay, so chest rises and falls symmetrically bilaterally. Patient doesn't have any increased work of breathing. I'm gonna go ahead and turn you around so I can do your thoracic expansion. Go ahead and take a deep breath. Okay, so I'm sorry, you're gonna do it one more time. So thoracic expansion is equal bilaterally, symmetrically. And then while I'm back here, I'm gonna go ahead and have you say 99, okay?
99. 99. 99. 99.
I'm gonna go under, okay?
99. 99.
Okay, so vibrations are felt equally, bilaterally, symmetrically. And then while I'm here, I'm also just gonna go ahead and percuss, okay? Just okay. Okay, resonance all throughout, which is an appropriate finding. Now I'm gonna go ahead and listen to your posterior, anterior, and lateral lung sounds. Okay, I'm gonna go try to warm my stethoscope, okay? Just take a couple deep breaths. Just try to lift this side. Okay, do the same thing on this side. Okay, I'll flip you around. Then your arm. Okay, so lung sounds are heard, are clear anteriorly, posteriorly, and laterally in all the lung fields. And then I'm gonna go ahead and auscultate the posterior side again. And this time, I want you to just go ahead and repeat E, okay? Okay, done. And just keep continuing to say E, okay? And now whisper just 1, 2, 3, and keep repeating that. Are you whispering? Okay. So E is heard clearly throughout the posterior field, and 1, 2, 3 is muffled, which indicates that there is no fluid in the lungs, which is an appropriate finding. And then I'm gonna go ahead and listen to your carotid arteries for any bruise. Let me just locate them. use the bell of my stethoscope. Okay. Okay, no bruits were auscultated, which is an appropriate finding. And then looking at the patient's precordium, it is appropriate color for ethnicity. It's pink. I see no lesions, no heaves, no lifts. I'm gonna go ahead and listen to your lung sound, or I'm sorry, your heart sounds. But you know what? Before that, I'm gonna palpate at the point of maximal impulse at the fifth intercostal space at the midclavicular line. So I'm just gonna go ahead and go from here. Okay, so that my finger is right here. Okay, so 2+. Okay, then I'm gonna listen to your heart sound. I'm gonna listen to aortic, pulmonic, tricuspid, and then mitral. I'll listen with the diaphragm, and then we'll listen with the bell of the stethoscope. Okay, and then we'll do it sitting and then laying. Aortic, pulmonic, tricuspid. Just go under. Mitral, sorry. Okay, and then flip it over with the bell. Aortic, pulmonic. Going right here again, tricuspid. And then mitral here. Okay. So S1 and S2 noted, no S3, S4 murmurs heard, but let's do it laying down again. Okay, so aortic, pulmonic, and then tricuspid and mitral. So I'm just gonna go under. Tricuspid, mitral. Okay. So again, S1 and S2 noted, no S3, S4 murmurs heard. Then we're gonna lift up your shirt for your abdomen just a little bit, okay? So just looking at my patient's abdomen, skin color is appropriate, skin's intact. I see no lesions, rashes. Abdominal contour is flat. And then I'm gonna go ahead and auscultate the quadrants, okay? Okay, just lift your. Sorry. Okay, good. Normal active bowel sounds heard all throughout 4 quadrants. And I'm gonna listen for bruits, okay? I'm gonna use the bell of my stethoscope. Okay, so aortic, renal, iliac. Okay, so no bruits were noted. And then I'm gonna go ahead and assess your femoral pulses. So that's just right here, okay? So I'm gonna, so femoral pulses are 2+, and then can you cough? Any pain? Okay, so no hernia is present. And then while I'm here, I'm just gonna palpate the inguinal lymph nodes. Any pain? No. Okay. And then while I'm here, I'm just gonna palpate the, you know what? Why don't you sit up again? Thank you. Okay. I'm gonna go ahead and palpate the, what's it called? The tibial pulses. 2+. Good, 2+. 2+. Okay, good. And then I want you to go ahead and we're gonna go back to the chair. So, oh, you know, I'm sorry. Actually, I'm gonna go back to the. I want you to lay down. I'm sorry, I forgot to do one test. for your abdomen, we're gonna lift up. Okay, I'm gonna assess your liver for the liver edge, and we're gonna do Murphy's sign. Okay, so I need you to pull up a little bit, at least until here. Okay, so try to relax your arm. Okay, so I'm just gonna try to palpate your spleen. Okay. Okay, and then go ahead, and I want you to go ahead and take a deep breath. Okay, and then okay, one more time. Take the deep breath. Okay, so Murphy's sign is negative and liver edge is not palpable, which is an appropriate finding. And on this side, we're going to go ahead and assess for the spleen, okay? Okay. And then the spleen is not palpable, which is also an appropriate finding. And then I'm going to go ahead and do some light palpation, actually, on your abdomen, okay? So just tell me if there's any pain. No pain. Okay, and then go ahead in with deep touch. Any pain?
No.
Okay. I'm gonna percuss as well, okay? Percuss the abdomen. Okay, so tympany all throughout. Okay, so that's an appropriate finding. Go ahead and we're gonna go back to the chair. Now we're going to go ahead and move on to the upper extremities. So with the upper extremities, you can probably go ahead and stand so you can test your range of motion. Okay, so just looking at her shoulders, elbows, and wrists, I see no obvious deformities. It is symmetric bilaterally. For your range of motion for the shoulders, go ahead and take your arms out, down, in front of you, backward. Okay, and then go ahead and go round, and then same thing, round. Okay, good. And then we're gonna go ahead and have you take your shoulders out, or your arms out, and then don't let me push down. Okay, good. So good range of motion on the shoulders, and then for the elbows, take them out, and then towards you. And this time, don't let me, push down, and then don't let me push against you. Okay, good. So range of motion on the elbows is 5 out of 5, and same thing with the shoulders, range of motion 5 out of 5. And then for the wrists, why don't you have them go up, down, to the side, and then flip them over and spread your fingers. Okay, good. And then go ahead and grab my fingers, and then don't let me fall. Okay, good. So range of motion 5 out of 5 on the wrist, upper extremity strength 5 out of 5. And then while you're already standing, we're gonna do the NURS test. So go ahead and take your arm inward, yeah. And then go ahead and try to make a circle. Any pain? No. Okay, so just no pain. Okay, and then do the other side. No pain. Okay, good. And then while you're standing, okay, let me see if I can. Any pain? No. Okay. So NURS test and Hawkins test is negative. Full range of motion 5 out of 5 on the upper extremities. Go ahead and sit down. We'll do the lower extremities. So I want you to go ahead we're gonna do the flexion of the hips. So just try to pull your legs up, or your hip, like your thighs up. Okay, good. And then don't let me push down. Good. And then for your knees, kick them out, and then backwards. Okay. And then when you're kicking out, I'm gonna try to push back. Don't let me push back. Okay, don't let me push forward. Okay, good. And then we're gonna go ahead for your feet. Okay, so pull your feet up, down, outward. Each like outward, and then inward, and then wiggle your toes. Okay, don't let me push up. I'm sorry, don't let me push down. Don't let me push up. Okay, so good range of motion on the ankles. And then we're gonna go ahead and stand up, and we're actually gonna do the range of motion of the hip. Okay, so we're gonna kick your leg out, backward, side, and then just go across, and then across, yeah. And then do the same thing on that one. In front of you, behind, to the side, and then across. Good. And then with the knee, just pretend like you're kicking a ball on each one. Back and forth. Good. Okay, good. So good range of motion on your hips, knees, ankles. And then while you're standing, just go ahead and touch your toes. Okay. So with that, here, why don't you do it this way, facing? Yeah, this way. Good. Okay. So looking at the back, her shoulders are symmetrical, her spine is midline. I see no evidence of kyphosis or scoliosis. And then let's do like extension of your spine. So just move, like try to do a back bend. Okay, side to side and to the other side. Okay, good. So 5 out of 5 muscle or range of motion on the spine, which is an appropriate finding. And then I'll have you go ahead and sit back. And then we'll do a couple neuro tests. So with the hands, I want you to go ahead and put them on your lap and then flip them back and forth really fast. Faster, faster, faster. Okay, good. And then we'll do the nose to finger. So you're gonna touch your nose and then to my finger, okay? And I'm gonna keep moving my finger. So just try to reach it. Okay, good. Good coordination. Okay. And then we're gonna go ahead and take your heel and go run it down your shin. And then the other side too. Okay, good. And then we'll do the sensation touch. So this is dull sensation. This is a cotton ball. This is what it feels like. This is sharp. This is what it feels like. So you're gonna close your eyes and you're gonna tell me if it's dull or sharp sensation and try to tell me where it is, okay?
Sharp on my right arm. Sharp left arm. Dull right arm. Sharp right arm. Dull left arm. Dull right hand. Sharp left hand. Dull right foot. Sharp. Dull left foot. Sharp. Sharp right thigh. Sharp left thigh. Dull left thigh. Dull right thigh.
Okay, good. Sensation is intact. And then we're gonna go ahead and let's test the vibration on your ankle and your toe, okay? So just tell me when the vibration stops, okay? Ankle.
No.
Okay, good.
He's everywhere.
Just do it here too.
No. No.
Vibration is intact bilaterally, symmetrically. And then we'll go ahead and test your reflexes, your deep tendon reflexes. So go ahead and put your arm on mine, just relax. Okay, so 2+ on the bicep. Go ahead and do the tricep here, okay. Okay, 2+ on the tricep. We'll do the patellar, so just relax. 2+ on the patellar and the Achilles. Go ahead and relax your foot, yeah. Good, 2+ on the Achilles. Of course, I would do it on the opposite side in practice. And then we're gonna go ahead and stand up again. We're gonna have you walk in a straight line this way, heel to toe. Good, okay. And if you wanna walk back, good. Okay, and then you can stop there. Good, so good gait, no issues in balance, any dizziness. Okay, good. And we'll do the Romberg test. So with the Romberg test, I want you to go ahead and stick your arms out. Okay, and close your eyes and feet together. Okay, so no issues in balance, no swaying noted. And then go ahead and open your eyes. We'll do the same thing again, but with your arm palms up. This time, close your eyes. So no pronator drift, no issues in swaying. Okay, good. And then let me think what else. Do we have anything else? How many minutes do we have? What is it? 30. 30. Okay, go ahead. Go ahead and sit back down. Let me just think real quick. Oh, if I palpated your frontal and maxillary sinuses, any? Okay, get the thyroid. The test. Okay. Yeah, just focus on your ego. Let me just make sure you're breathing. Just thinking.
It's raining.
believe that's it. And then again, I just want to note that she has no upper or lower extremity swelling, no indication of cyanosis anywhere. And again, if I didn't do something on one side, I would do it on the other in practice. So that's all for me. I have. Thank you for your time.
Thank you.
Thank you.